Hi there, Dr. Darrow.
Hello, Nita Valens. How are you this morning?
Great. And yourself?
Living it up.
Yay. I like that a lot. So we want our listener to know that this is a show about musculoskeletal chronic pain. So you can call us all hour long about your muscle pain, your joint pain, your tendon pain, ligament pain, back pain, disc pain, neck pain, knee or hip or elbow pain, arthritis pain, etc. And when you call the program today at 866-870-5752, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And you can also find a lot of information on the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can also see him performing the treatments on video. Pretty exciting stuff. We are here Saturdays at 10 and again at 1 p.m. And you can, again, call us right here, right now at 866-870-5752. Call early in the hour so we don't run out of time for you at the end of the hour. Very important.
Tell us about the free book, Nita, because I have a copy in my
hand. The free book
has
actually 264 scientific studies, and it's in answer to everyone that was pestering you over the years, Dr. Darrow, who kept saying, where's the research, where's the data on how stem cell and platelet therapy works, also known as PRP, platelet-rich plasma. So regenerate, don't operate literally means that if you're going to go into an elective surgery, then there are these natural treatments that lots of people don't know about yet. This is a new paradigm, although not brand new because it's been around for decades. Maybe you can address that a little bit, but it's new to sort of the average person who doesn't know people.
Well, we have we've got an explosion of what we call regenerative medicine going on, with seminars for doctors being given every day. But I've been doing this work over 20 years, and it's been on the planet for that we know about in this form using injections for almost 100 years. And previous to that, going back to China with heating up needles in a form of acupuncture, going back 5,000 years. In Western medicine, we know about the use of this type of regenerative medicine in a very crude form. Hippocrates took care of the Olympians, and we know of stories of javelin throwers who had dislocations in their shoulders, and Hippocrates would scald the axilla or the armpit to decrease the range of motion. Today there are surgeries to do that, but not really needed because I do it frequently, just injecting the shoulder with platelets from the blood or from stem cells, either from bone marrow or from umbilical cord blood. And all of those procedures work very, very well. Not on everybody. There are people that don't get better, and there's a lot of reasons for that. And some of them are that they keep doing their activities without resting the area and letting it heal. Others will stop the treatment before it's done its full job of healing. And I hear it all the time. People come back and they go, I can't do any more treatment. My doctor, my orthopedic surgeon said this can't possibly work. And that's a shame because the younger guys now, the younger docs are learning how to do this, thank goodness. And I've been teaching this at UCLA for 20 years, or maybe a little more. And thank goodness the younger guys want to learn how to do this because it's safe. All you do is you walk in the door, you get an injection, and you walk out. Even if you have knee pain, you can still walk out, foot pain, whatever. So it's a conservative treatment, and using your platelets, it's called PRP. That's PRP, platelet-rich plasma. Very simple process. We draw the blood, we spin it in a centrifuge, we throw away the red cells because they hurt and cause inflammation, and then we just inject the platelets and create healing that way. And we can take that and mix it with umbilical cord stem cells, and we get amazing results with that. And occasionally people want to still have an older form of bone marrow aspiration. I did 2 of those yesterday in a row, which I was surprised about because most people are not interested in getting their pelvis drilled anymore. I have done mega thousands of those, and I still like to do them, but most people don't want that done when the results we're getting just using umbilical stem cord cells are the same. And we have a giant study that'll be coming out shortly that'll be published showing that umbilical cord stem cells with PRP are just as effective as bone marrow stem cells with PRP. The nice thing about doing the bone marrow is the PRP is already there because bone marrow has peripheral blood in it, so you get both at the same time.
That's exciting stuff. You're listening
Yes.
to Living Pain-Free with Dr. Marc Darrow, and our number for your calls is 866-870-5752. 30 to 40% of Americans, perhaps more, are in chronic pain. And if you're one of them, the quality of your life is compromised. Give us a call. Let's talk about it. 866-870-5752.
So
You have a question.
I do. The office number, if you want to call in and get an insurance verification to see if your insurance will give you your first visit at least, that phone number to the office is 800-300-9300. There are people by the phones now. And we do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare. For people without insurance, we take Care Credit, which is a credit card that we can help you get on the spot, and that gives you time to pay it off without interest. Unfortunately, regenerative medicine is not paid for by many insurances, so you'll have to call the office and see if it is covered, and what we take is what you have. So that's 800-300-9300. So here's I get emails all day, all night. You can get me through an email on my website, which is www.lastemcells.com, and you can email me from any page there. And I get emails all day, all night. I answer them in between patients. I answer them when I wake up in the morning. I answer them when I go to sleep at night. So here's a short question that just came in. I have very minimal disc left at L5-S1. I'm in pain all the time for years. I have done epidurals. Is regenerative medicine indicated for my issue? I won't know the answer to that till I touch your back and do a quick exam. I can tell you in about 2 seconds. Because there's disc degeneration, or what we call degenerative disc disease, does not mean you have pain. So be very careful. Don't run to get surgery or listen to your surgeon because he looks at an MRI and says there's something wrong. We do studies, and it shows that people have all kinds of stuff that show up on MRIs or X-rays that have nothing to do with pain. You'd look at it and go, whoa, that's a terrible MRI. I must have pain. But these people don't have pain. We take people and we say, who doesn't have pain? Those are the people we test, and we find herniated discs, we find meniscal tears in knees, rotator cuff tears in shoulders, all kinds of stuff. Don't get snuckered into a surgery because you have these things. They may not be causing pain. I had a gentleman come in yesterday. He was pushing a couch, moving backwards, using his butt to do it, and he heard a loud snap in his knee. MRI was done. MRI showed all kinds of stuff. I don't think any of that was causing his pain. I think he sprained his knee. The loud pop What could that be? The patella can come out of its track in the femur. It's called the trochlear groove. And I don't think this guy has all these problems that he thinks he has. Yes, he does have anatomical deficiencies, but I think that's been there for a long time. So we have to be very careful not to jump to a surgery just because you find problems on your images, your x-rays, your CT scans, or your MRIs. So the fact that this person who sent me this question says they have degenerative disc disease in their back does not mean they're getting pain from that. Most back pain is really from ligament issues. In the low back, we have the iliolumbar ligament that attaches to the pelvis. We have the muscle from the ribs that attaches there, and we have the thoracodorsofascia that attaches there. So if you have a herniated disc, that's deep down. That'll be causing leg pain more than back pain. So if you have back pain, don't think of these other things. Be careful. Too many people come in, they've had failed surgeries, and when I touch them, I go, this wasn't even the area that you had operated on. I had another one of those yesterday that came in. Person had back surgery, and when I touched the area where the pain was, it wasn't anywhere near where their scar was. Wrong diagnosis, surgery done for the wrong reason. We don't want to keep this happening. We want to be safe.
Absolutely.
So, should I go to...
number,
oh, you know what? Yeah, go ahead, do that.
Our number is 866-870-5752. And, so many people are in chronic pain, Dr. Darrow, that if one person calls and let's say they have this disc pain that you're talking about, well, there's dozens of other people listening that also have that disc pain. So you're not only calling for yourself, but you're helping other listeners who aren't calling. So it's a good idea to call, and you can get kind of a free consultation right here, right now with Dr. Darrow. It's 866-870-5752.
Let me take another question. Let's see.
Sounds good.
Let's find one on a knee. Father's knee. Okay. My name is, I was referred by, my dental hygienist, Marianne Delaney. Thanks, Marianne.
Oh, we haven't talked to her in a while.
No, she's probably listening. She listens to most of the shows. Marianne came in, she's a great story, very overweight and pain pretty much all over. And she's pretty pain-free now. Actually, right now she's got a little heel pain because she likes to get up at 4 in the morning and run for about 6 miles. Nothing major, though. So this person was referred by dental hygienist Marianne, who speaks of you in extremely high regards. Thank you. Emailing you on behalf of my 82-year-old father who has a serious knee issue and constant pain. Pain and inflammation associated with his knee has rendered him essentially immobile. He's been to several orthopedic surgeons over the years and has had cortisone injections. Please don't do that. That kills the cartilage and makes it worse. And Hyalgan, which is hyaluronic acid, which does nothing. It makes people feel good sometimes, but it doesn't fix anything. It's a lubricant. He's gained no relief. Not a candidate for surgery because high risk on blood thinners and unusually high risk for infection. What else? His right knee bends awkwardly inwards and back and angle has no stability. According to what he has told me, the doctor has explained that he has both severe ligament and cartilage damage. I've attached some pictures to give you a visual of what we're describing. Any input you have would be appreciated. Well, I need to see this guy because this is a little complex. A lot of side issues. And my guess is we can help him somewhat, probably not totally fix the knee, but even in extreme cases, we can help reduce the pain by growing some of the tissue back. So there is good hope, and I hope you're listening to the show so that you can get in if you want to call the office and see if your dad's insurance is covered. He's probably got Medicare at the age of 82, which we do take. But the office number is 800-300-9800. 9300. And I'll repeat it once more, 800-300-9300. So we're looking for your calls. Makes it more fun.
That's right, 866-870-5752, 866-870-5752.
So a couple things I want to talk about. The vampire facelift. That sounds cool. Simple process, taking your platelets from your blood or your stem cells and injecting them into your face. Just like I grow cartilage and collagen all over the body for sports injuries, musculoskeletal problems, arthritis and whatnot. My wife, Michelle Darrow, does the same process on the face to grow back the collagen and make people look young. She also does it on the top of the head for hair growth, and amazing procedure. Also, I like when people listen to the show before they come in. I had someone come in yesterday, and they said, go ahead, talk to me about my diet. I know I need to lose weight. I'm not going to get mad at you. I listened to your show, and I knew you were going to talk to me about it. And, I warn people, if you're overweight and you've got lower extremity pain, I'm going to please ask you to lose some weight. Cut out your carbs is an easy way to do it. Stick to protein and veggies and water. That's the best way. Unless you have some kind of kidney problems, talk to your doctor about it or talk to me about it. But every pound you lose is 4 pounds off your poor knee. So if you're 25 pounds overweight, that's 100 pounds every time you step up of extra weight on your knee. And yes, that does cause arthritis. So we use the Ideal Protein diet, and people lose about 15 to 20 pounds a month. I tried it when I was sampling diets. I lost 7 pounds in 1 week. And if you're watching me on the video right now, you'll see I'm a pretty skinny guy. So it gets rid of all the excess fat on the body, lowers your insulin. If you're a type 2 diabetic, it gets rid of that in most cases. So it's a great, simple diet to do. What else, Nita? Should I go to another question?
Well, before you do that, just want to let people know you're listening to Living Pain Free with Dr. Marc Darrow. And we take your calls all hour about your chronic pain issues. That's musculoskeletal pain. Our number is 866-870-5752. Don't be shy. Give us a call. And you can
free book.
Go to the website and
free
get
book.
a free book. The free book is Stem Cell and Platelet Therapy. It's got 264 scientific studies. It's amazing. And check out the website. You can email Dr. Darrow off of every page if you're looking for a private conversation. And that's lastemcells.com. That's www.lastemcells.com. You can also see Dr. Darrow performing these treatments on video. If you're really confused and you're visual, you want to see what we're talking about, then go to the website and then call us.
So
this could be the treatment for you.
Nita, I don't know if you have a copy of the book in front of you, but we have a picture of Suzanne Summers, and she wrote the foreword of the book for me. Thank you. God bless you, Suzanne Summers. She does so much for the alternative medicine community, and she tries everything that she talks about. So she has written a whole chapter in her next book, which is coming out in a couple of months. So I expect I'm going to be very flooded with patients because of her. She's very good to me, and I take care of her and her family. And I love all you guys. The Summers are an amazing group of people. So thank you for all that you do. So I'm going to jump to a question on hip bursitis.
All right.
So this person says, I have hip bursitis and I'm interested in injection therapy. Can someone get back to me? Thank you. Complex area. When we're dealing with what people call the hip, there are so many different things in that general neighborhood that doctors get confused. Yes, doctors get confused. Most of the time when I get a patient and the doctor has diagnosed it improperly because they never even touch the area to find out what's going on. A hip bursitis is typically on the outside of your thigh. Okay? So a lot of times people come in with a hip bursitis on the greater trochanter, and they have gotten a hip replacement for that because the doctor saw some arthritis in the joint. That's a no-no. You don't do a surgery when it's not indicated. And I've seen this way too many times. People come in, they've had a hip replacement, they're still having the pain on the outside of their thigh, which is the bursitis. Why is that? The doctor made the wrong diagnosis. He saw some arthritis, he changed out the parts and put in metal and plastic. The person didn't get better. It wasn't the right thing to do. Be careful. Hip bursitis is a very easy thing to fix. There are 14 attachments of different muscles to the greater trochanter. Most doctors think there's one. There's one bursa. No, there's a lot of them. So we use platelets from the blood or stem cells, which we can get from bone marrow or from umbilical cords. And those are donated by the moms. I had a woman come in who works for an outfit that is against abortions. And she said, well, I don't want the cord blood because I don't want babies to be aborted. These are not from aborted babies, and they're not from babies at all. These are from live births, from the umbilical cord that goes from the baby to the placenta that would normally be thrown away. Their moms donate these. And it's a very efficient way to get stem cells, and you don't have to have your pelvis drilled. In the study we are doing at my office, we have a 20-person research team, and we're finding that the umbilical cord stem cells mixed with PRP work just as well as the bone marrow. So save yourself some drilling. So yes, this is something we can easily help heal up. May I go on, or do you have something you'd like to chirp in with?
Well, I actually like to chirp in with the phone number. Our number is 866-870-5752. That's 866-870-5752. How about we talk to Chris?
Chris, Dr. Marc Darrow, you have pain in your lower spinal column.
Yeah, I think it's at lumbar 5, I guess the very last one.
Okay.
And it's progressively gotten worse, but...
Over what period of time?
I'm 59 now, and it started like maybe when I was 18.
Oh, my goodness. You've suffered for a long time. What have your doctors told you about it?
Just that. They x-ray it, degenerative disc, it's worse. So I have the teeter, and I've upside down teeter, and it might not work for everybody, but it does work for me in the fact that I've been a couple of times where I got up or for whatever I was doing the day before lifting or whatnot, and I couldn't even tie my shoe. And a couple of times. So I got on the teeter, and boy, I went to work that day.
Wonderful. So spinal decompression is what's going on with that. Are you hanging upside down?
Yeah.
Okay. Yes. Be careful if you do that, by the way.
It seems like now that it seems like, it's like in the past 2 months, it's just gotten worse. And I was listening to you when you were talking about, I was poking here, there, whatever. And it's not even the degenerative disc. No, I don't have the pain down my legs. I never have.
Okay, Chris.
Hang with
hold
us.
On a second.
We're going to break. We'll talk to you after the break.
We have to take our quick little break here on Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Grab a pen or a pencil, write down this important information coming your way, and we'll be right back.